part 2 of Foley catheter insertion for a male client. We left with part 1 in doing the peri-care and cleansing the area really well. And now we are going to wash our hands. I have pulled the covers back just enough to cover the feet. And then in providing privacy, I have to make sure that I'm only exposing what is necessary in order to do the procedure. Okay, so we've got that area prepared, and remember the legs are slightly what? Abducted. That's A-B-D-U-C-T-E-D, abducted, which means they're open just a little bit, okay? We have our Foley catheter kit. We've got another pair of sterile gloves just in case we were to need that. And I have some tape here. So I'm going to tear off 2 pieces of tape. And you'll see what those are for in just a minute. Okay, so in opening the kit, right off the bat, there's going to be a label if you decide, or if there's an order for a specimen, a cath specimen, then you would use that. We're not going to need that. We're going to use this outside bag as a trash bag. So you can choose to put it at the foot of the bed, or you can actually tape it to the bedside table. If your patient is cooperative, you can put it over the bed as much as you need to without contaminating your area. Putting the cover in here. So how do we open sterile packages? You want to make sure that you maintain your principles of sterility now, and you know that you're going to open distal, then you're going to open your lateral sides, and then you're going to open proximal. Anything hanging off of the table is not sterile, which there will be parts of this hanging off of the table, as well as the outer 1 inch. So you always are really careful about opening up your equipment when it's sterile. This package right here has a shiny outside layer to it that is a protective absorbency for anything that gets wet that's on the inside. Make sure your table, though, is free of wetness, it's clean, and it's dry. Okay, we've got the bed at the right height, the table's at the right height. I'm opening up distal, and we're going to open up your lateral sides, only touching the outside part. There's no reason to reach your hands or fingers on the inside. Now this last flap, which is going to be proximal, closest to me, right on top is a pair of sterile gloves. And I may want to use those sterile gloves. If so, I'm going to need to get them without contaminating my sterile equipment in there. Okay. So I'm going to get my sterile gloves out. You've all been passed off on actually how to put on your sterile gloves. So this should not be anything new to you, but if you're having trouble with it, you may want to practice. You're going to open up your distal, proximal, and then you open up the sides. Any part of this package that's touching this outer laying for the Foley is going to be unsterile because my bare hands have touched the outside of the package. But I'm well within my border of keeping everything sterile. So I'm going to pick up my first glove by holding the cuff, step back. Always keep it above your waist. You have a non-sterile hand, a sterile hand. So take your time. Don't move so fast. You may actually contaminate and not realize it. Pick up your other glove. Underneath the cuff, make sure this thumb is out of the way. You don't want to accidentally hit your skin. I'm completely sterile, okay? The next part is a pad that has a shiny side and a duller side. This is actually a water absorbent or absorbency type pad, and you want to put the shiny side down. Just put this across their lap, and you want to think about having your back to the patient and just lay it down. Okay, what we're going to do is create a longer sterile field. The next one is a fenestrated drape. This is a very, very big one that's in your kit, okay? You can touch this, do not touch the bed, okay? Back to the patient. Now, if you need to touch, only touch here in the center. Okay. Now we're going to open our kit, and I'm going to unstack the trays. So in the tray, we have got our betadine or iodine swabs. The patient's not allergic. You want to open it up, take your swabs out, have the swabs where you can reach them without reaching over your equipment, and then throw this away. If you can't put it in there safely, just lay it on the table, and then we'll put all the trash in there in a minute, okay? This is actually for your lubricant for your Foley catheter. Go ahead and open it, put it in one of the trays here on this, and I'll throw it away. So the next thing you have is your actual Foley kit, your Foley catheter bag. So your Foley catheter bag has got a urine specimen container in it and a lid. We do not need that right now. There is a plastic sheath or cover that's over the Foley itself. Be very careful taking this off because you can risk contamination if you're not careful. So I just kind of wrap it around my hand to keep control of it so it doesn't flop. This will be trash. Okay, let's talk about this Foley catheter right here. This catheter has got 2 lumens, and those 2 lumens serve a purpose. One is to inflate the balloon, and the other is connected to a closed drainage system. It is never opened in that area, and it goes to the bag itself. Some kits, actually most kits, say do not test the balloon. Evidence-based practice has actually shown that whenever the balloon is blown up, it does not shrink back to a smaller size. It leaves it just a little bit bigger. So that could cause trauma to the actual urethra. But you're going to actually inflate your balloon for right now. And on here, actually on your Foley, it says that this is a 12 French 5 cc or 5 milliliter balloon. So you want to only put in 5 milliliters. We're testing the balloon. Okay, it's not leaking, it's not broken, so you let it drain back. Now you could actually lubricate this if you wanted to, but I wouldn't because there's not lubricant in here to hold it in place. We will lubricate it before we actually get ready to put it in. Just put it back into the box. So the next step is to actually clean the area. So if the patient is uncircumcised, you're going to have to retract the foreskin, just like we would have during pericare to cleanse well. So in picking up the penis, we're going to clean around, starting at the meatus and down. So you go around and down. Throw that away. again, around, starting at the top, going down, around. So now we're at the point of getting ready to put this in. So what I would suggest is just go ahead and bring the box over here. We've lubricated it, and you're going to lubricate it very good. You know, 4 to 6 inches lubrication, as much as you can get on it. Now, how far do we go inside when we're inserting into a male? A lot of reading will tell you 6 inches, 4 inches, 6 inches, 8 inches. I suggest you go all the way into the actual bifurcation. And you'll see why here in a minute. Do not touch the penis, you're just feeding the catheter in. Okay, so we've got it in. We're going to hold it down. Then we're going to insert using how much? 5 milliliters. And once that's in, disconnect. And when you give it a tug, it's going to come back out to as far as it needs to go. All it did was curl back up into the bladder. Okay, so we have urine that's coming back. It started actually before we ever got through. The patient is feeling relief. We're going to go to the next video to actually do securing the device. Thank you.